Hey guys, we're doing another doctor series, and I'm really excited because we have Dr. Reuben Elovitz on today, and he's all the way from Dallas. He actually has his own concierge practice in Dallas, in the heart of downtown, and we're really excited to have him on today. And so he's the CEO and founder of Private Health Dallas, and he's going to be talking to us about all things COVID-19 and about internal medicine and why he became a doctor. So thanks so much for coming on today.
Thanks for having me. Great to see you.
Yes, great to see you too. Happy Friday. So I did want to kind of talk about a little bit about you being in the hot zone in Texas right now, because I was reading some new statistics, and apparently Dallas County has experienced a stretch of 18 days with more than 1,000 daily cases of COVID-19. And so I know you've been really busy. Can you share more about your experience and what's been going on? What have you been seeing within your practice, and how are things going for you?
You know, within my practice itself, I've got a relatively small concierge practice. So we've only had a couple of patients who have been positive, and in the grand scheme of things, their symptoms were quite mild, didn't require hospitalization. And then some of the businesses we work with have had a significant amount of more positives, especially for a few weeks. One of the companies, which were the largest one that we deal with, they've been really good about isolating, tracing the exposures that their employees have had and keeping them at home and their contacts at home. And so they've actually really, in the last couple of weeks, have seen a dramatic decrease actually in the cases in their company. I would say as a whole for Dallas has, as you mentioned, had a stretch of, I don't know if it was 18 days or how many days. Starting this weekend, we did actually see a little bit of improvement. So we had a day where we had 700 cases. And then yesterday, I think we only had 400 and something cases. The downside is with all of these, one of the things that you'll hear from physicians or from the epidemiologists or the experts is that as the cases go up, at some point, we'll see the hospitalizations lag behind and the deaths lag behind. And so the hospitalizations in Texas have increased fairly dramatically over the past few weeks. And the nice thing is that we have actually, over the last week, 7 to 10 days, have seen a plateau in our hospitalizations. Unfortunately, the deaths have now started to follow as well. So we've had a dramatic increase in our deaths over the last 7 to 10 days as well. Mm-hmm. And so the hope would be is that will plateau here in the near future as well.
Yeah, I mean, sounds like there's a lot of things happening right now in Texas and just throughout the U.S. So, you know, obviously when COVID-19 happened, that must have really impacted your business. How, as a business owner and a doctor, did you feel that you had to switch gears in terms of your concierge practice that you have?
You know, for everything that I do for my concierge practice is trying to find for my clients what is the best of the best for them as patients. So from a standpoint of understanding what is the best therapeutics that are available, making sure that I have access to, which is hard when you're an individual physician, although we partner among other concierge physicians. But again, still when you're trying to go to get things from a practice of one versus a large healthcare system, it's very different. So knowing what the science is, knowing what the best available options are, trying to get contracts squared away for things like that, so that when patients need to be tested, what the options are, where I can send them, that I can have priority access or try and get priority access if my clients or patients need that. And then also for the different aspects of our business is just trying to figure out what we want to bring on for our clients. Most concierge medical practices that have a membership-based program, if you bring things on that are new, you don't typically make money off of those because you don't increase your prices for those. And every practice is different as to how concierge are structured. But for me, it's also a big part of in concierge medicine is about being a one-stop shop for your clients, being able to provide. So if I'm able to provide them what they can get at my office and not have to go to an emergency room or an urgent care facility, that's obviously a great option to have. So for me, it's been lots of research and speaking with lots of different companies and trying to figure out what is the latest and greatest thing available and what's the latest and greatest on the horizon.
Absolutely. And what can you share with us some of the services that you do offer for your patients, and how does concierge medicine work versus regular medicine? What's the differentiator? There can be some confusion over that. So first, the breakdown of that, and then the services that you do offer.
Okay. So in concierge medicine, if you take a traditional physician's practice, typically those are going to have anywhere between 2,000 to 4,000, or potentially even more if it's a family practice in a smaller town, for example, or a smaller city, I guess I should say. But a typical concierge practice for an internal medicine doctor, you're going to scale down a practice from a size of anywhere between 2,000 to 4,000 patients. In most programs around the United States, typically are going to focus on somewhere between 300 to 600 patients. They're going to provide a much more accessible practice, not only to the staff, but to the physician, either himself or herself. And you get a much more level of personalized, individualized care from that doctor. All of them are structured different. Some of them are going to have fees that are combined with taking insurance and Medicare, and there's those that don't take any insurance or Medicare. In different areas of the country, and depending on if it's through a large organization or independent physicians, they're all structured in some manner or fashion, some of which are going or not going to include coverage. And then from a standpoint of what services are going to be available is also going to vary pretty significantly among most practices. For ours personally, the goal is to provide them with a fairly aggressive, comprehensive program for prevention as part of a physical, whether there's someone who's 20 years old, 40 years old, or 60, whatever it may be. And then having significant options available, or comprehensive options available for diagnostic tools and management for when people do develop diseases. Some of those services will include, instead of doing basic body fat, for example, we do what's called body composition analysis with the same scan that you would have a scan for osteoporosis. We do bone density on most patients. We do vertebral fracture assessments looking for compression fractures in someone's spine. We do a broad spectrum of lab work, dramatically more comprehensive than what you would get at a traditional annual physical with your primary care physician. We offer genetic testing. That's not something someone needs on a yearly basis, but it's something we'll offer as a baseline. Stress testing or cardiac stress testing. And then we usually do baseline imaging and then repeat it every few years, which is typically a CAT scan of someone's chest, heart, abdomen, pelvis. And depending on someone's medical problems, we do ultrasounds of their heart, ultrasounds of their carotids. The other services, I guess, sorry about that. The other services that would include for those that need it, would be everything from, on trying to coordinate multiple other services on the same day. So whether that's their dermatology visit, visit with an eye doctor, ophthalmologist, audiologist. So we try and coordinate for people that are getting their physicals, especially if they're in from out of town like Chicago. We want to be able to get everything done on the same day to make it easier for them. So if we have executives who are coming in, we don't want them to have a list of services that they do over 2 weeks, which is what happens in traditional medicine usually.
Yeah, absolutely. And it kind of ties into my next question, which is, can you share with us why you became a doctor and why internal medicine?
Why I became a doctor. It started kind of a cheesy story, but it's true. It started at a very young age. We had a family friend that I called Uncle Brother. He was friends with my parents, but he owned a hardware store in downtown Birmingham, Alabama called Ace Hardware. And from my recollection, I was either 5 or 6 years old. I used to go in every Saturday and work in the store. Considering how big and strong I was at that age, I used to break down boxes and move boxes and nails and stuff like that. Whatever it was almost like I looked up to him. So it was kind of a cool thing as a kid to be able to work. So I used to spend Saturdays with him and then go back to his house with him and his wife, and I'd usually crash on their couch. Anyway, one day at the store, he fell to the ground while he was on the phone and I didn't know what it was, but it was a seizure. And unfortunately, that was the last time I ever saw him. It turned out he had a brain tumor and never recovered and ultimately passed away from it. And from that moment on, I kind of wanted to be a neurosurgeon. That did change over time throughout my career. probably the biggest change is ultimately I had an opportunity when I was in medical school at Baylor to operate with a renowned surgeon named Dr. DeBakey. Most people know him. He's got several classification systems, and I wanted to be a cardiothoracic surgeon prior to going there. The downside to most of the surgical subspecialties as a student is you learn to see what the lifestyle of those doctors is like. And they spend a crazy amount of time in the hospital. And I already knew how anal and obsessive I was at that. And I wanted to be able to also be a father. And I knew that that would not be conducive to me having children. So over time, it changed. And ultimately, for me, the best part of being and why I chose internal medicine is I love the relationships that I'm fortunate enough to be able to develop with patients and their families, whether it's their kids and grandkids, whether it's their grandparents. So for me, that's probably the most special part of what I do.
I think that's a wonderful story. And I definitely think that, it really kind of brought you to where you are today. And can you share with us, why you decided to actually open up your own practice versus, you mentioned it a little bit before and hit on it in terms of not being at a hospital every day, but, taking the leap and opening up your own practice is a huge deal. And I know that, it's still kind of a new practice. So what kind of made you think like, I'm going to do that leap right now? What were those steps?
From very early on in my career, I was with a large healthcare system here in Texas, and I was in a very large group. By the time I left, I think it had over 45 doctors, all internal medicine docs. And it was a fantastic group. It was a fantastic experience. Being there, I learned a ton. But at the same time, I learned a lot about myself. And for the same reasons I had concerns when I was in medical school and in residency, a large part of traditional medicine is based upon the volume of patients you see. And some doctors, including several of my colleagues, are great at that. They're great at minimizing the time in the room with a patient and being able to take care of the most urgent issues, making the patient feel like they've had a lengthy visit, and be able to get them out the door and be able to see 20, 30 plus people a day. That is not me, and that is not what I'm good at. And I knew that very early on. And for me, there was one physician out of the large system that I was in who had somewhat of a concierge practice. And for me, after learning more about concierge and researching the different options available around the country, I had approached the system I was with to do something similar, help design a program that ultimately I decided to not wait around for, because the concern I had with most of the large hospital systems is legally how they get around this. And then more importantly, you're still part of a large system, and and it should be, their primary focus has got to be on providing care for the millions of patients they take care of, not a small, very tiny subset of doctors that want to provide a very specialized care to a very specialized subset of patients. So I decided ultimately to leave, and it was a very difficult decision, not only because of the patients I left behind, but the colleagues that I had developed there. Some were still very close friends of mine, and one of which I considered my mentor, and he's a fantastic physician. And had an opportunity to go to Cooper Clinic. I was there for about 4 to 5 years, and that was also an amazing opportunity. It allowed me exposure to sides of preventive medicine that I had not seen before. And so for me, I was able to kind of blend everything I'd learned with Baylor, everything I'd learned at Cooper Clinic from a standpoint of their comprehensive exams, and kind of for me was be able to blend both into what I thought and what I hope is what's best for my practice and my patients. And it's been great so far. I've loved it, and it's been it's more of a risk, but I have that entrepreneurial spirit. Most people say for doctors that's dangerous, and it probably is. But I've had fortunate to have amazing patients. I have amazing staff, and it's been wonderful so far.
That's great. I love that journey. And I know that you also have another business too. Can you tell us a bit more about Private Health Fitness and what that business does too?
Sure. So as part of the entrepreneurial side of Private Health Dallas, is in any practice, medical practice, or doctor's office, there is downtime, whether it be when a physician is on maternity leave or paternity leave, if doctors are sick, whatever that may be. And so for me, when I'm busy with patients, there's lots of equipment that I brought on to be able to provide a certain level of care in my practice. And it would be nice to be able to utilize that even when I'm not utilizing it on our patients. So giving people that don't necessarily have access or don't necessarily want to have to pay for the full onslaught of services that we have available for our concierge memberships, but want to be able to get certain types of tests, whether it be blood work, whether it be for the body composition analysis, which kind of basically looks at your degree of muscle mass versus fat content, and gives you a whole host of data from visceral fat, resting metabolic rate, et cetera. It gives them an opportunity to be able to see not only what a concierge practice looks like, but also provide services that you cannot get at a traditional doctor's office, especially for those that have high deductibles. It can actually be less expensive than doing it through their own physician.
Very, very good information. And you touched on before about, wanting to be a father and that being important to you along with being a doctor. Do you have any advice for, balancing those two? As a doctor, you're very busy. So any tips that you've learned along the way or anything you'd like to share about that?
I have tips. I'm not sure I'm a shining example of balance, but I think trying to really look at as an individual, especially if you're married, is trying to find that balance early on in your career. For me, that has been a struggle throughout my career, and I think for a lot of physicians who are love to learn and are passionate about medicine, it's hard. Especially COVID is a perfect example, or coronavirus is. There's so much information out there, and if you love to learn and you love to read, I love all that stuff. And the downside is at this point right now, with all the information coming out, you could read incessantly. Mm-hmm. So taking the time to find those things and making time for your kids, your marriage, your family, is really trying to mold your practice, whether it's your individual physician, or whether it's a physician in a large hospital system, is having those things in place so that you not only take time for yourself, take time for your kids and your family. I think for each physician, that's different as to what they need. But if you don't even start with the mindset of having that as part of it, and unfortunately, I think that it is with the level of burnout in this country for physicians, it's, I think, probably fortunate that there's been a big push by the American Medical Association and other associations to try and figure out ways to allow physicians to maintain that balance, and learning that from a very early point in their careers, whether that's in medical school, residency, etc.
Absolutely. And then just my last two questions is, you talked about like the consumption of information due to COVID-19. I know that you do your own videos on your Instagram every week talking about updates for the coronavirus. Is there any misconception you would say that you'd really want to hit home on today's episode?
I think the misconceptions, and it's hard. I think any physician that's out there that's trying to provide useful information, I guess we have to know, and it's hard for all of us, you have to know when you're saying things that are potentially misleading, whether it's the public, whether it's your own patients, whether it's other people's patients, or anyone. And the downside is, as physicians, we need to know when we're doing things that can potentially be harmful, and making sure patients understand that if you're providing treatment options for patients, that you don't promote them in such a manner that you mislead the patient. So, for example, there are a lot of treatments out there that are promoted as being a silver bullet or a magic bullet or 100% cure, whether it's the combination of azithromycin and hydroxychloroquine, or whether it's hydroxychloroquine itself, or whether it's one of the recent ones is a inhaled steroid called budesonide. And whether or not those ultimately will show some benefits, that remains to be seen. And there are, in some studies, benefits of hydroxychloroquine, and we do know that there's benefits from high-dose steroids in patients who are critically ill. But when you start advocating treatments for patients that are not proven, and we have data to show that the evidence behind it at this point would suggest the contrary, you create a situation where people want to grab onto something and to be scared, and they focus on a treatment that really has no proven benefit. That's not as much of a concern if it's not harmful. It maybe end up being expensive, but it's not really harmful. The downside to some of the treatments that are being promoted, including the azithromycin with hydroxychloroquine, for patients who are doing that as outpatients, that can be very dangerous. And so anytime people are seeing those things on social media or internet or television, is just to make sure that you discuss before you do anything, is to discuss that with your primary care physician, and have them look into it. And don't believe everything you hear, whether it's coming out of my mouth or anyone else's. It's something that, especially for a new disease like this, things are changing on a daily basis. And anytime someone says that someone took one pill and was miraculously better in 10 minutes, you should think twice about when there's no one else on television talking about that same treatment. And just be careful where you're getting your information from. If all the experts and the scientists say that that doesn't make sense, and the data that's already there shows that there's no proof, there's a good chance that there isn't proof yet. So.
Well, thank you so much for kind of sharing that with us. We're wrapping up here, so we just want to lastly ask you, where can people find information out about your practice and perhaps follow you on Instagram as well?
Sure. Our website is www.privatehealthdallas.com. And then on Instagram or Facebook, it's Private Health Dallas. On Facebook, it'll have Private Health Dallas, and then it'll say Reuben Elovitz, MD. And we'd love for you to watch our videos. And if there's things that you would like to hear about, or for me to discuss with respect to most recently to coronavirus, or any medical issues that relate to internal medicine, I'm happy to read and comment on those. And if I don't, I'll explain why I don't. Thanks for having me.
Thank you so much, Dr. Reuben Elovitz. We really appreciate it, and we hope you have a great day. Thank you.
All right, you too.